Welcome to Knovva Academy. My name is Alex Crosser and I'm head of online learning. We're very excited to present the Pandemics and Public Health Initiative designed to help teens around the world be better informed about one of the most impactful events of the modern era. The COVID-19 pandemic is an unprecedented challenge to our modern systems of healthcare, our economies, and our systems of governance. Global collaboration is more essential now than ever. But what does that collaboration look like? What should we be doing to tackle this crisis, and what are we actually doing? We're very fortunate today to be joined by Dr. Jing Ma, Associate Professor in Population Medicine at the Harvard Medical School and the President and Secretary General of the U.S. China Health Summit. Dr. Ma, thank you for joining us today. In a few words, could you introduce yourself to our students and describe a little bit of your background?
Thank you, Alex. My name is Jing Ma. I came from China 30 years ago, more than 30 years ago. And I was trained in medicine in China and also public health of master's degree. And I came to the United States to gain my PhD of epidemiology. And then after that, I started to work at Harvard University Medical School since 1994 as an epidemiologist. Yeah.
All right, very impressive. And it sounds like you have a load of experience from all over the world. So we're excited to learn from your experience. So this is a challenging time for everybody. And so to start off, I just sort of wanted to know, what are you doing to stay healthy in body and mind during these times?
I have been working at home, but very busy, keep my schedule full. But also I trying to find some time to do a little exercise and trying to get connected to outside the world in the United States with my colleagues, my friends, my family, as well as with colleagues in China and also in Europe.
Are you able to get directly involved in the fight against the COVID pandemic? And if so, what are you able to do?
Yes, as a as a faculty at Harvard Medical School, but also as a trained in actually Wuhan Tongji Medical University in Wuhan. I have been closely watching what's going on in my partially, my home school and my home medical school and my hometown. I spent about 20 years there. So I really had a very close contact with my friends, alumni, classmates over there, almost on a daily basis. And I felt the pain there. And I watch them and I communicate with them. At the same time, I try to help. So that's, fortunately, I'm working with my colleagues, my friends, my many volunteers at U.S. China Health Summit. And we start to work right after the announcement of the outbreak in China, in Wuhan. So we quickly organized and mobilized volunteers, not only on donations and the PPE support, but most importantly, we called ourselves as the intellectual supporting group. So we trying to use our knowledge, our public health and medical background, even some ITs, and we quickly collect information, and we do analysis, and we trying to provide as much scientific-based evidence as possible. First, early on in China, to China, and now we're trying to forge the connection between China, US, and the world. That's what we have been doing. And that really helps us to keep busy.
What sorts of data are you analyzing and sharing?
All sorts. We have different groups, subgroups, working groups. We have policy group. We watch what's going on in China from the beginning, how Wuhan was shut down, and after shutdown, how it operates. And at the same time, we're trying to look at around the world, WHO and U.S. CDC, what kind of preparation on this side of the world has been doing. And we're trying to communicate with the Chinese leaders in the Ministry of Health and also the local hospital CEOs. And we're trying to pass on the information to them. And so that's on the policy level. And we also have groups on studying mechanisms, how the immunity has been created, and how the virus caused the outbreak, caused the disease, and also what kind of drugs could help in the development of the drugs, of the process, and also vaccination, the checking, the test, different kind of ways of testing, the virus testing directly, and also the antibody testing. So we have all kinds of groups, and we produce our digest. Almost every day we have produced at least 2-3 pieces of digests, and we put on our WeChat public platform. And early on, so that was all in Chinese because we're trying to help the other side. And recently we are focusing more on our website to really to make a Chinese language and English language in parallel, so we can have a better communication and a better more audience towards a more global view.
So it sounds like you're doing a great job of not just connecting experts with each other to share information, but also sharing information with the general population.
Yes.
So you mentioned the field of public health, and I know that you're an expert in population health. And I was wondering if you could describe what the difference is, or what is population health?
Good question. I was trained in public health, and in Wuhan, China, in Tongji Medical University, where they have the hardest hit. And that was about a long time ago. I should not say the years, how many years. But at that time, we were told public health is the occupation. You care about the sky, the air. Basically, you care about air. You care about earth, environmental health, and you care about people. So anything outside of hospital, you will take care about, right? In terms of people's health. So public health is really a collective of field to take care about people's health as a whole, and in an organized way, I should say. In China, the public health has a broader definition, including environmental health, occupational health, infectious disease control, nutrition, maternal and child health, and also mental health. So we have all kinds of subfield, but more so public health is more focused on maintaining a well-being of humankind. And population health is really a relatively new definition, which has been emerged in the late 1990s. To me, population health has been defined as the health outcomes of group of individuals, including distribution of such outcomes within the group. And to me, I think population health really covers the spectrum of people's health, not only non-disease people, but also in the healthcare system. So it's really emphasis on the patterns of health determinants The determinants means what decides your health status before you get sick, and what determines of care after you get sick, and what determines how soon you get recovered. All those, in the old fashion of public health, with too much emphasis on some non-social determinants. We talk about germs, we talk about environmental factors, we talk about occupational factors, physical factors. But right now, as the knowledge grows, and more and more we understand there's so many social determinants other than physical, other than biological factors affect your health and your health care recovery. So based upon that, we can make recommendations, we can do research, and we can make recommendations to policies, and also we can conduct interventions. These kind of interventions, not only for drugs, but also for the society as a societal experiments. And then we watch how those determinants, how those interventions will make different kind of health outcomes. So I think it is, as a society, we really have to rethink about the social benefit. One key thing is universal health care coverage. I mean, U.S. is the only, I'm not sure the only OECD country has not have a universal health coverage, I think. That really put people in a very, especially people with low income and unemployment, because most of our insurance are covered by our work site. And if people lost jobs, that means they lost their insurance as well. And what does that mean? Especially in this situation, who covers their health care? Those things need to be sorted out. One thing I should praise U.S. is I heard a lot of schools, even though the schools are closed, but they still open for meals. Those are essential measures for breakfast and lunch. That so many kids, I'm surprised to see so many kids are depending on school meals for their nutrition. And the government, the federal government, quickly mobilized the resource and money to ensure those school lunch are provided in the community. And for that, I should really praise our government for that. So it is not only the virus, but all this social impact it causes, and it has a long-lasting effect. And as a society, we have to think about it and address it. And the last one, everything needs a dollar. So population health also pay attention to induce the reduced per capita cost by doing those interventions, doing those campaigns of population health. So to my understanding, population health covers including public health, but has much more beyond that. It has also involved healthcare delivery organizations, hospitals, community health centers. It also has education and income. The income means the education of the population, the incomes of population that traditional public health doesn't have much of a control, and also community organizations. And finally, is everything has to involve business, to mobilize business community to work with communities, work with people to pay attention to people's health. So overall, population health has a much broader spectrum, I should say, than public health by itself.
So along those lines, there's been a lot of talk in the news about COVID-19 patients and their symptoms and how possibly to cure them. But in the interest of population health, everybody is being affected by this, whether they have COVID-19 or not. And so I'm very curious about what research is being done, or what questions do we have about the effects of the pandemic on everybody's physical and mental well-being? What is the impact of lockdowns and isolation, for example?
I should say, so far, based upon what we have seen and what we have read, in terms of research, a lot of publications has been focusing on trying to understand the virus. We still need to learn more. But what we have learned so far, we know it's a novel virus, we know it's contagious, and we know everyone could get it. And that really is scary. And that scares people. I believe most of the people, obey the order of the government, staying at home, and also trying to protect ourselves by different ways, masks, washing hands, etc. But that means the whole society is basically stopped activity. I mean, fortunately, we can link through this new way of communication like this. We can talk, we can still see each other, but that's very different from personal contact. For instance, my daughter is pregnant. She has 1 more month to go. And she stayed in the same city. I cannot see her. And she's very anxious because she has, in a month, she has to go to the hospital to deliver. I'm sorry. So you said that this virus really changed our life, changed the way we interact, even change our family. And there are lots of research needs to be done. And like my daughter, how that will affect her baby. And she's still worrying about potentially, at risk, get infected, going to hospital to deliver. And we not every day, but we frequently discuss what's the plan. Shall we go to see her after her delivery? How can we see the baby? Could they be, quarantined for another 2 weeks before we see them? I mean, that's just a routine. For us, it's just like a regular life. And we have to have this anxiety there. Not to mention about families getting infected. Not to mention about nursing homes. Not to mention about those healthcare workers working in the front line. They have to risk their lives on a daily basis. They have to go to nursing home to take care of old people. They have to go to hospitals to take care of the sick people. And a lot of people staying home feel lonely, feel isolated, feel depressed. So the whole world is changed. I don't know how many research we need to be done. But right now, we haven't seen much of the research, how that changed people's behavior, how that changed people's mindset, and not mention about anxiety and depression and even like chronic diseases. People staying home, who care about them? They're worried about going hospitals. People with cancer. And that's what we're going to talk about in our international webinar. We're going to have a hospital CEO from Cancer Hospital in Shanghai talking about at this moment, at this time, how can they take care of cancer patients? And how can they take care of kids with asthma, with allergy, with so many health problems. So in short, this little invisible virus changed our life, changed our mindset, and changed our behavior. And I do hope our audience, our young people, really think hard about what's the future. The future belongs to young people in how we live, how we take care of this world, this globe. Not only global warming, but the whole nature. There's so many tons of unanswered questions. And we are actually, the U.S. China Health Summit, we are recruiting some talented high schoolers, and we're trying to have them to work with grad students, doctoral students, and trying to think. I'm not sure how much problem we can solve, but at least we can think. We can research on it.
That was a very powerful answer. Thank you for sharing. So, of course, taking care of everybody is vitally important at this time. And an article came out this week about an emergency room doctor in New York who took her own life as a result of the traumatic experience of having to deal with COVID-19 patients and the exposure to risk and the exposure that they bring home to their families. So I was wondering if you had any advice or suggestions as to what we can do to guarantee the physical and mental safety of our frontline healthcare workers. Are there systems we can put in place? What can we provide them with?
It is hard. I mean, from China, from Wuhan, so many stories we have heard. Nurses, they cannot go home. Doctors, they have to stay in the hotel on a daily basis. And after they take care of, spend long hours taking care of patients dying, watching so many devastating situation, and they have to go stay in the hotel and sleep alone because they cannot share rooms even. They cannot talk because doctors, nurses have to keep distance. They stay in the hotel room alone. The only thing they can talk is through cell phone with their family and some colleagues. It is very, very hard. And I also heard there's so many people working in a nursing home. And they are really short of manpower there. And some people quit, and some people has to work multiple shifts. As a society, I think, we really show our sympathy to them. But at this moment, I don't know, how can we help them? We pray for them, and we show our admiration to them. And I think that as the public, we should really send a message to really show our appreciation. It is them to keep us safe. It is them to sacrifice their house, to sacrifice their family. So I think this society, our media, our news, we need some positive energy. We need the federal government, the state government, those who can speak in the public to really pass the positive energy, the appreciation to these people. Not just fighting, not just pointing fingers, not just pointing fingers to this country, that country, to this city, that leader. We have to work united as a whole to overcome this devastating time, this devastating, deadly virus. And only by doing that, we can win.
Hear, hear. Well, thank you again for the work you're doing to help bring people together. So you've mentioned some of the work your organization does to help spread information around the world. And I know that a lot of people are trying to find a balance between watching the news and staying informed, but not being too informed to the point where it impacts negatively their mental health, and also trying to get information from reliable sources, so that we know, so that we can have a realistic understanding of what's going on. So to ask a question about that, I'm going to turn over to one of our students.
Hi, my name is Zhang Lingdeng. I'm a current high school student studying in the International Department of number 50 Senior High School in Shandong, China. I'm wondering, like, as teenagers, how can we possibly identify or critically analyze the information we receive from different sources of media in order to get a relatively unbiased views on issues regarding to the coronavirus outbreak?
That's a good question. Right now, the booming of all these kind of media really, on one hand, it's good. It spread the news very, very fast. What happened on the other side of the world, we'll immediately see on this side. That's a good news of information sharing, which is very, very important. Especially with the infectious disease, because people travel all the time, and we need to know as soon as possible what's going on at different corner of the world. But as people staying home, or I don't know what kind of motivation, there's so many rumors around, and unfunded evidence, unfunded information. As a teenager, as people, we should really use our judgment to try, us as a scientist, we're always trying to prove. So I always ask our volunteers, we produce information has to be based on solid evidence, and we have to cite. Each information we produce, we have to have a resource. Most reliable resources are peer-reviewed scientific papers, research. But even that, we still have daily newses. So we tend to trust the major stream of newses, and also I'm a fan of NPR, National Public Radio. So I trust their information, and also I trust their very in-depth, on-point, etc. Kind of discussion, and we trying to use our best judgment. And I'm glad Dr. Fauci, U.S. has him as a chief scientist in this pandemic, and he always make corrections and make the right direction. Or even though sometimes he explained to us bluntly, this is something I don't know, we're still under research, right? We have to have that kind of scientific attitude, and we use our best judgment and try not to spread rumors. Only science can save the world. Not only the science, but science can save the world, plus the right policies. Yeah.
I completely agree, as a huge fan of science myself. And that science should be the thing, or one of the factors that is heavily influencing the policies. So thank you for bringing both of those up. So you mentioned how valuable it is that the news allows us to find out what is happening on the other side of the world. And that's so important, especially today, because in the past, especially 50 years, globalization has completely reshaped the way we live and work, how we manufacture things, how we communicate. Actually, you know what? I should stop myself because a student is going to ask this.
Hello, I'm Saif from Egypt. I'm a high school senior. I would like to know how this situation will affect global policy moving forward. Will globalization and global trade, immigration be affected?
Okay, thanks for the question. I think that's a really people already feel that globalization has been affected by this coronavirus pandemic. For instance, early on when China has had the outbreak, many flights were stopped. Flights, between U.S. and China, between Europe and China and other countries, and right now, I'm affected too. This is the time I plan to go to travel to China, and I cannot because the flight was stopped, and also I was told if I go, I probably will be hard for me to come back, even though I'm a resident of this country. So it is affected. And also, I think last week, President Trump also mentioned about issue this immigration, stop the immigration to U.S. I don't know for how long, but at least temporarily. But in terms of globalization, there's a good things and bad things. I should not say bad things, but affect people life on the positive way and negative way. For instance, the medical equipment supplies. All of a sudden, U.S. realize there's so many essential medical equipments are all produced in the third world, and you have to go around to search. Of course, China also provide a lot of support through a lot of people, American Chinese communities and other big companies, and help to mobilize the PPEs, masks and ventilators. But again, so many essential equipments. To my, I think the government believes should be also, have the capacity to produce locally. And globalization also, I believe, make the richer, the rich people or companies richer, and left many low-income people. I should not say poor, but not catching up. And that really comes back to our social determinants of health. And with our globalization, with economic development, I think everyone has the right to have a fair share of the development, have to have the fair share of the profit, the benefit, and especially the essential cares, food, nutrition, and medical care. They, as a government, as the big companies, as the whole society, we should not let people behind. And that's what our young people should think hard through education, through healthcare, and through many social supporting programs. And that's really something this world need to be rethinking about this globalization. Globalization doesn't only mean economic development, but also means education, social welfare, and many humankind, environmental protection, greenhouse effect. The whole world need to have a global solution. U.S. cannot solve it. China cannot solve it. Individual countries cannot solve it. And so we really need to think about this globalization as a broader scope, a broader view to address global problems. Yeah.
So hopefully this pandemic will have helped us realize the importance of not just economic globalization, but of education and access to healthcare and whatnot.
Yes.
So obviously, the pandemic is having a major impact on a lot of these social determinants that you've been discussing. As of today in the United States, today, April 30th, 2020 in the United States, over 30 million Americans have filed for unemployment in the past 6 weeks. So can you talk a little bit about how this socioeconomic shock may make some of the health challenges faced by vulnerable populations worse?
Unemployment, not only because they don't have incomes. Of course, I hope the federal government will support these people through unemployment benefit. But that's a not long-term solution. And again, the social welfare has to be rethinking and redesigned. And how, as a society, could help them, mobilize them, and physically, mentally. Not only, if they lost, there's some studies have shown people lost jobs are more easily to get sick, through depression, through unhealthy diet, or through alcohol abuse, some other domestic violence. So many related issues. So unemployment is not just the company's own issue or the employer's issue. It is a societal issue. So as a community, as the government, locally and federally, we have to address that. And how can we mobilize, encourage people to get re-educated or whatever, occupational change. And that has to be addressed. I don't know how. I'm not expert on that field, but that's a global issue. This is not just the U.S. China is facing that serious problem too, and Europe. And we haven't mentioned about Africa, South America. So we, as a rich, people living in this rich country, we have many benefits. But we have to think about people in India, people in Africa. The government cannot give them unemployment, benefit. And how about their kids? Who will feed them? Who will take care of them if they're sick? So many unanswered questions need us to think about it, and also need a global effort to help. And that's what when we talk about globalization, that's the area we need to address.
So as we talk about trying to get the world back on track economically, obviously there's a tension between maintaining social distancing, which will help keep people safe, and the economic impact of social distancing. So to ask a question on that, I'll turn it over to another student.
Hello, my name is Tomoki Matsuno, and I'm a senior at a high school in Ibaraki, Japan. A couple of days ago, I saw a simulation by Harvard University that says this social distancing may be needed into 2022, in 2 years from now. I understand the importance of infection prevention, but if this coronavirus continues to affect the economy till 2022, the global economy will be so depressed. So I'd like to know, when we can or should somehow put the economy back on a path in this challenging situation?
Your student let's ask very, very good questions. Yeah, very thoughtful. It is true, Harvard professors, my colleagues, have proposed that this could be a new norm of keeping social distance in the near future, next year or for the following year, which is still under debate. But we have to be prepared, mentally prepared and physically be prepared. And so it is relatively easier for us. We can work at home. For people working in the office, computer related, information exchange related. But it will be hard for those people who have to go to factories. For instance, like a meat processing factory. I heard, President Trump has to order the meat processing factory to open, even though they have so many factory workers got infected. But they have to be there to deal with those, products. And nursing home caretakers, they have to go to take care of those people who are needed. So there's so many occupations. It is very hard to keep social distance. But this social distance, we have to have this mindset. We have to be prepared. And even though we go back to work, we go to office, and people face, when we go, I can imagine when I go back to office, I would not, hesitate to hug people anymore. Definitely no handshaking anymore, right? And it changed our behavior. It changed our personal contact. I think social distance is necessary, especially during this pandemic period of time. But what I'm saying is, mentally we have to be prepared, but even more so, we have to be prepared to have a stronger health status. Prevention is the most important. Prevention means we have a physical measures, like a physical distance, like washing hands, like wear masks. Those are all physical measures. But we need also to have a healthier body in order to against or prevent the virus. Or even though we get the virus, we can only have milder symptoms. For instance, data have shown majority of the people have severe case of coronavirus, or people who died are either old people or people have chronic disease conditions, hypertension, diabetes, kidney problem, liver problems. That really gives us a warning. We, as young people, have to grow this healthy behaviors, healthy lifestyle to keep our body stronger so we can fight not only coronavirus, but any kind of virus, any kind of infection, any kind of diseases. That's most important. We cannot just hide. There's a coronavirus, and next year or the following year, next decade, we'll have different kind of diseases coming. And we cannot just hide, staying home forever. We cannot do that. So I'm, as a preventive, as a population medicine, population health researcher, I have been spending the past 30 more so years studying determinants of health. Means nutrition, means exercise, means sleeping. You need to maintain a good sleep in order to have a good immune system. You need to have a positive mental status in order to have a strong immunity system. Everything is linked. So I know my kids too, you guys, young people, like to play computer games, like to not sleepless the whole night. I should warn you, from now on, keep a healthy body is more than ever important. And in that, you can have a stronger body. Even though stay home, you can still exercise. So again, keep your own health is the better than ever than keep distance, I should say.
All right. So unfortunately, one of the consequences of staying healthy and keeping non-COVID patients from becoming COVID patients, it means that a lot of people are having to put off other medical procedures or aren't going to the doctor when they would be otherwise. And so to ask the question, we'll turn over to another student.
Hi everyone, my name is Sarah Ben Halima. I'm from Revere, Massachusetts. My question for the professors today is, how are healthcare centers, hospitals, and the overall healthcare industry responding to the ongoing demands and needs of non-COVID-19 patients? Thank you.
That's another good question. I heard from my colleagues, my schoolmates from Wuhan and from here, my colleagues here at Harvard affiliated hospitals, many non-essential procedures has been postponed. Cancer patients, for instance, if they need an IV and they have to be turned into a oral medication, which may not be as effective. And many surgical procedures has been postponed because doctors or the surgical ward has been turning into ICUs in order to treat the coronavirus patients. So many challenges for hospitals. We have to face that, and some patients cannot wait. For instance, I heard the news kidney transplant patients. They cannot wait for too long. And those people with emergencies, like baby delivery, you cannot wait. So I really admire our hospital management team and our doctors, essential doctors and non-essential doctors, the ER, the ICU doctors, and even pediatricians. They have to take extra cautious. And that's what the communication we have been trying to forge between U.S. and China, because China already passed that period of time, and they are gradually recovering their capacity. Because during the pandemic, most of the essential care has been stopped, and now they gradually, recovering from 50% of the capacity, 60%, 70%. Recently, we heard like 80% of the capacity of hospitals care has been recovered. But things are different. Usually, 2 people can share one room in the hospital room. Now, they only allow 1 patient per room. That means they have to reduce the care capacity. And each department, not only respiratory, like some other, like cardiovascular and some other departments, they have to have a special room put aside in case they found some people has a potential infection. They can quickly isolate that patient. So they have all these measures, and they have a thermometer, automatic thermometer in the gate of the hospital to check on every patient and visitors going into the hospital. So that caused a lot of procedural hurdles and management hurdles, and every department, doctors, they treat themselves like a ED, like a infectious disease, department doctors now. It puts more pressure on the healthcare system, and they lost their revenue, and they also have much more burden. So we should really thank them, and we should really the society find a way to appreciate them and to support them. And for us, again, keep ourselves healthier is a way to help them, I should say.
That's beautifully said. Thank you so much. Thank you for taking the time to speak with us today. And I'm so glad that we can provide an opportunity for you to share your expertise with our students.
First of all, I thank you for your invitation of this webinar and to give me this opportunity to communicate with high schoolers because and with a broader audience. As a researcher, we tend to talk to our colleagues, our special fields. But through this coronavirus, over the past several months, through the later January to now, through our organization, through a lot of collaborations, we not only talk to my colleagues, in the medical fields, but also talk to a much broader audience. And through this kind of communication, I more and more realize health education is very important. And through this, you just mentioned how people can get true scientific information. It is only through this type of communication and channel we can communicate with a broader audience, a public, especially young people. They are the future. Thank you.